So welcome for all of those people that are in the room. We're going to do a general round of introduction. What I'm going to have is people that are giving lectures. There's when you get up to kind of give your lecture, if you'll just do your introductions and stuff like right at that point. But for those and other people in the room, we'll go through kind of a little bit of period of time where you can just tell us why you're here, like what background you have, so that we can kind of know how to tailor this. Because I think this is a unique situation where we have at least a 1-to-1, if not a 2-to-1 ratio, and I think we can keep it very focused on what your kind of needs are within this talk. But I'm going to go ahead and get started just to tell you kind of what our general objectives are for this. So we kind of broke this out into a 6-component part. The first part is looking at how to critically assess emergency care problems kind of within the context of artificial intelligence. And then taking that and taking those problems, kind of what things can you do from an artificial intelligence standpoint, from a technique standpoint to address those. And then the next part of this, and generally the way the whole kind of lecture is structured, is about the steps along that process. So many people in the room have done one part of that step or many parts of those steps in bringing kind of artificial intelligence and emergency care to fruition. And we'll kind of go through those steps, and hopefully kind of at the end of the day, the takeaway will be you have a kind of a holistic aspect to kind of what it takes to get artificial intelligence up and running in emergency medicine. And then last, we'll talk about barriers, and the barriers will kind of be throughout all of the lectures to kind of understand why you're not seeing a ton of artificial intelligence yet within emergency care and in medicine in general. So this is the outline. I'm going to cover kind of problem specification initially. We're going to do some model development, data considerations. We're then going to have breakout sessions. So there's 2 breakout sessions. The first one will kind of cover the topics for the first 3 lectures. Then we'll talk about infrastructure and the user interface. We'll have another breakout section that'll be more kind of on user-centered design and thinking about kind of how you would design a clinical decision support tool or something around artificial intelligence. We'll then lastly talk about safety and monitoring, and then we'll open it up for Q&A. And because of the small group that we have here, I would say in general, just keep this informal. Please feel like you can interrupt anybody throughout the whole session. And because I think you'll get a lot more out of it if we ask questions and like that. Okay, so now I'm going to take the time, if you don't mind, for those people that are coming to the talk and not giving lectures, because we're like half and half divided. If you can just introduce yourself and maybe just give a little bit of background, either to say you have programming experience, not programming experience, informatics experience, not informatics experience, do you live in the quality and safety world or something else? What are you hoping to get out of this, et cetera? Because if we have a room that's all biostatisticians, we can tailor it a little bit differently as far as what we talk about. If we have people that are all quality and safety, then we can tailor it a little bit that way as well. So maybe I'll start with you, and then we can, if people can just go around the room and just kind of introduce yourself and kind of talk about these things.